Nini. Biko, today is our second meeting. As usual, we're going to start the meeting with a lecture to be given by one of our own, Chike Obi. We're proud to have him here today. So, welcome. As you all know, Chike Obi is one of our own. He's the son of Dr. Isaac Obi and Chinwe. You know him as Odunze. So thank you, Dr. Chike Obi, for coming to give us lecture today. I'll give you a little brief history about or introduction of Dr. Chike Obi. Chike, as you know, is an American-born Nigerian citizen, as well as a Nigerian, with Nigerian parents. He went to his medical school in the Loyola University, Chicago, Illinois, after which he went on to do a 3-year fellowship in cardiology at Henry Ford Hospital, Detroit, Michigan. That seems not to be enough. He went on to do a fellowship, 1-year fellowship, 3-year fellowship in cardiology, and then subspecialty in advanced heart failure and heart transplant at University of Minnesota Medical Center. He works as a cardiologist at North Memorial Hospital, Minneapolis, Minnesota, currently. Dr. Chike Obi is a board-certified internal medicine physician. He's also a board-certified advanced heart failure physician. He's also American Board of Heart Transplant physician. He's a member of various physician groups in America. Currently, he works as a consultant at North Memorial Health Hospital in Minnesota and has multiple outpatient clinics and inpatient consultant services in cardiology, advanced heart failure. In his leisure times, Dr. Obi enjoys playing and watching sports, traveling, especially to Nigeria during Christmas time. Dr. Chike Obi, please welcome. Ndi AGULU, please could you welcome Dr. Chike Obi?
You're welcome.
Thank you for having me. It's an honor to talk to you guys about your health maintenance, something that I like and enjoy with prevention. So we can go ahead and get started with that. It'll be tailored towards prevention and looking at patients who are of African descent for the most part. One of the things that we kind of struggle with, I think, as immigrants from Nigeria or Africa in general, is just trust within the healthcare system. And so that can lead to various issues in terms of following up with care or doing the required care that we should be doing. And so it takes a lot of commitment and a lot of work from the physician and the patient to try to determine when it's best and how it's best to go about these situations. And so with this, I think it's very important that we have representation within the medical field so that when we go and see physicians, we can go and trust who we're seeing and acknowledge that they're going to be the ones that are going to help us and look to help us with our care. Especially when we're coming from Africa, Nigeria in particular, there's certain things that we take for granted and we forget about when we're here in the United States. We may have issues from the past, just dealing with general loneliness and being away from home. Some of us may have issues with language barriers, adjusting to new roles that we've changed from transitioning from Nigeria to the United States. Differences in our relationships with family members or work relationships, trying to live up to the American dream. All these things can put pressures on us. Dealing with changes with racism that we may not have experienced back in Nigeria. And so all these things can play significant roles in terms of one's health, and looking at how we can go on with prevention is very important. In terms of what we see with diseases that are common when we come from Nigeria to the United States, big things we think about are things like infectious diseases that we can acquire. There's various other things like vitamins deficiencies, and then in some cases tuberculosis, malaria, and things of that nature. As we work towards this, there's different things within the United States that causes patients or people of African descent that have high prevalence that we may not have thought about when we have traveled from Nigeria to the United States. And big diseases that we think about are things like depression, diabetes, heart disease, substance abuse, obesity, cancers, hypertension. And so taking into account all those things can help guide us as we look to work towards prevention. And so when we start with prevention, the big important thing is going in to see your provider, whether that's a physician or an advanced practice provider who's working with the physician. And so it's generally recommended that we follow up every year or 2 years, depending on your age. If you're in the 40s, they usually say every 1 to 2 years. Once you hit 50 or more, they generally say every year you should follow up with a physician just to go over your health and have things checked, like your blood pressure, your weight, and making sure that you're staying on track with those guidelines that are recommended. And so what I typically do when I see patients in clinic, the first information I usually get is regarding one's weight, blood pressure, and cholesterol levels. And then once I've focused on their initial complaint, then I start to ask general questions about what could cause them to be at increased risk or higher risk, or any life-threatening things that may not have been addressed in their initial complaints. And then from there, we can go on to conduct tests and look at other things. And I think the same thing applies with the internal medicine clinics or family medicine clinics, wherever you seek your initial care. And as we mentioned initially, diabetes plays a big role. So in terms of screening and things to look out for, it's recommended that once you are at age 45, you be screened for diabetes with a fasting blood glucose check every 3 years. There are certain things that put you at increased risk, which can be being overweight or obese. And then if that's the case, it's recommended that you be screened at age 40. With regards to specific cardiovascular diseases, high blood pressure is one thing. Patients should be screened annually beginning at age 40. There should be measurements done within the clinic, and if anything is elevated, then it's recommended that you take home blood pressure readings. And so for any of you who do have high blood pressure, if you don't have a blood pressure cuff at home, it's recommended that you have one so you can at least be monitoring your blood pressure at home. Different risk factors that can lead to increased blood pressure include being of older age, being Black, having a family history of high blood pressure, being overweight or obese, not exercising enough, stress, and tobacco use. And so other things that can contribute would be diet, high salt or high fat in the diet, or increased alcohol intake are also contributory to high blood pressure. Within the cardiovascular world, we try to work on counseling to get patients to improve upon some of these risk factors. And so we encourage exercise 20 to 30 minutes every day, 5 days a week, roughly. And we encourage a healthy diet. One of the diets that has been looked at as being helpful is the Mediterranean diet, which consists of vegetables, fruits, whole grains, beans, and low fat or fat-free dairy products, fish and poultry, non-tropical vegetable oils and nuts. And then it places limits on sugars or sugary beverages, salt, highly processed foods, or refined carbohydrates or processed meats. One of the big things they recommend is use of olive oil, which is generally good. And as I mentioned, fish and poultry are good proteins that can be used within the Mediterranean diet. Wine in low to moderate levels has been shown to be good. One of the things that we do see relating to patients of African descent is sometimes the use of palm oil with cooking. Palm oil has some benefits, but does also carry some risks with use. We know that palm oil has a good source of vitamin E, and it allows for better absorption of other vitamins, other fat-soluble vitamins, and so it can help out with absorption of vitamin A and vitamin D, which can help with your eyes for vitamin A and can help with your bones for vitamin D. It's been, in some studies, vitamin E has been shown to be able to reduce or halt the progression of heart disease or brain disease. And so in some cases, there may be some benefits, but at the same time, there are risks with palm oil. We know that it will increase cholesterol levels in healthy patients, and high cholesterol is a big risk factor for heart disease. It can be also linked with plaque buildup in the arteries, particularly in reheated palm oil. And then it is high in saturated fat, so it does have its problems, and its use is generally thought to be best if it's limited. The other things we do check, like we talked about within cardiovascular disease, are your cholesterol levels. It's recommended that you be screened every 5 years, more frequently if you have cardiovascular disease. The age to start screening for men is generally at 35 and above, and then women at 45 and above. And then you would start earlier if anyone is at increased risk. And then moving on to another subject that's great for prevention is within the vaccination or immunizations. We know that this is a great way of preventing people from acquiring disease, and it's recommended for all adults that they receive the Tdap vaccine, which is tetanus, diphtheria, and pertussis. This is done every 10 years. Sometimes it can be done a little bit more frequently if one exposes themselves to certain things, but generally every 10 years. The influenza or flu vaccine is recommended every year. If you're above the age of 50, they recommend that it's not the live virus, but although the strains can vary, it's definitely great at reducing one's risk for acquiring serious disease. And then the other important vaccination to receive is the COVID-19 vaccine. It's been shown to be helpful in reducing hospitalization, reducing severe illness. And so those three are recommended for all adults. There are other ones that are good vaccinations for ones to receive. If someone has not received them or have not been exposed to these diseases, things like the measles, mumps, rubella, and chickenpox vaccines. As we get older, the zoster can occur in patients who have been exposed to chickenpox. And so if you're above the age of 50, it's recommended to get that vaccination. And then there's a certain set of vaccinations that are important if you're traveling, especially to highly endemic areas. Nigeria is known to be an endemic area for hepatitis A, hepatitis B, and so getting vaccinations for hepatitis A and hepatitis B is recommended. One of the other things is meningococcal vaccination. That is important. The northern part of Nigeria is within the meningococcal belt, and so there is chance for exposure to the meningococcal virus or bacteria, and so getting that vaccination is helpful as well. With regards to special populations, if anyone does have sickle cell disease, which can be common within Nigeria, getting a Haemophilus vaccination is good to help prevent against infection from that bacteria. And then moving on to cancer. Cancer, we know, can present in various ways within the community. There's different types of screening that is recommended both for men and for women. If we're looking at women in particular, it's recommended that they do pelvic and breast exams yearly. Sometimes this can be done with the physician. Sometimes breast exams can be done at home. That's recommended usually monthly for women. For the pelvic exam, it's with the pap smear to look for cervical cancer. This is for women ages starting at age 30 up to age 65. A mammography is recommended within that breast exam every 1 to 2 years for women who are 40 or above. Some say that you can do it every year as well, but that should be discussed with your provider. If we look at specific cancers for men, the one that we think about is prostate cancer. Prostate cancer can be high within the Black community or in the African Nigerian community. Screening for prostate cancer carries various concerns because prostate cancer in some cases is not a lethal cancer. It can lead to more complications if one seeks treatment, then it may be of benefit. And so in terms of screening, it's best to discuss with your provider regarding screening. Patients who maybe would be best served with screening if Okay, sorry, I was muted. Where did I last leave off?
You were talking about prostate cancer screening.
Okay. Yeah, so sorry about that. Prostate cancer screening. If there's a high family history of prostate cancer, then that would be the ones who would recommend getting screened potentially for prostate cancer. But there are benefits to this and risks to this, some usually pertaining to the treatment that can occur for prostate cancer. The screening ages, if one is seeking screening for prostate cancer, is usually between the ages of 55 to 70. And if we're looking at cancers that can affect both men and women, the one we think about is usually colon cancer. Screening for colon cancer generally is recommended to start at age 50. There are some guidelines that suggest starting earlier. Again, within the Black community, some would go down to age 45. Screening consists of a colonoscopy. Is probably the most common test, or possibly even the simplest one, which is done every 10 years. There's other types of screenings that can be done to look at who may have colon cancer or be at risk for colon cancer. But again, discuss with your provider on that aspect. The next cancer, lung cancer. And patients who are at risk for lung cancer, it's generally people who, in terms of screening, would be those who smoke. If one has been smoking for about 20 years or so, and they have not quit smoking, then they should be screened for cancer. If you quit more than 15 years ago, the screening is usually not recommended. But the age for this is between the ages of 55 and 80. In addition, if someone related to this, but not a cancer screening, if someone has ever smoked, then it's also best that they be evaluated for having an enlarged aorta in their abdomen. Smoking can lead to changes within the arteries of the body, and so smoking can cause rupture of this artery. And so if you've ever smoked, it's recommended to have your abdomen scanned to look for an aneurysm or an enlargement in your aorta. And this is usually done in men at the age of 65. When we move on to other potential areas for screening, which can be done within the African Nigerian population, we look at things like infectious diseases. We know that there are some infectious diseases that are very prevalent within Nigeria. The ones that are recommended to be screened for would be, one is tuberculosis. Some of you may have been vaccinated against tuberculosis, others maybe not. And so screening for tuberculosis is recommended even in patients without symptoms. Other areas of concern for screening, we kind of touched upon some of this with the vaccinations that were recommended, but they are usually sometimes sexually transmitted diseases. So things like hepatitis B, hepatitis C, and HIV. Those are things that is recommended that people be screened for beginning at the age of adulthood generally, and going up to possibly age 80. The next area of importance we can talk about is with medications. There are some medications that are good at prevention, especially in the older population. One is with the cholesterol medication, so things like your Crestor, your Lipitor, or your Pravachol. These are other names are rosuvastatin, atorvastatin, pravastatin. If anyone has risk factors for cardiovascular disease, which would be high cholesterol, diabetes, high blood pressure, smoker, or family history of heart disease, there are guidelines that say if you're between the ages of 40 and 75, that it would be best to be on a cholesterol-lowering medication. You see your provider, they will generally calculate your 10-year risk for having a stroke or heart attack. And if that score is elevated, then again, best that you be on a cholesterol-lowering medication. Some of this plays in with the use of aspirin. Aspirin use daily has some controversy to it. Within the cardiovascular field, we usually feel that it's recommended for anyone who has had a stroke or who has known blockages in their arteries. And so we put those patients on low-dose aspirin. There are some guidelines that recommend that a daily aspirin may be helpful in certain patients who have a elevated 10-year risk score, who are between the ages of 50 and 60, and who are not at increased risk for bleeding. Then they can take a baby aspirin to help prevent cardiovascular disease and also to help prevent colon cancer. Other medications that are good for use in terms of prevention would be the use of vitamin D daily. It's recommended that you receive about 1,000 units of vitamin D daily. This can help with increasing calcium in the body and helping with bones in the body. For us, especially people from areas in the United States that don't receive as much sun as they typically may have received back in Nigeria, use of vitamin D can be helpful in terms of helping out with bone disease. And so getting screened for vitamin D levels is also a plus. If you're over the age of 50, it's recommended that you take around 1,000 milligrams of calcium daily, again, to help with bone disease. And then for some of us who may be on more medications because of various medical conditions, it's helpful to discuss with your doctor about what medications you should be taking and if there are any that you can eliminate or take away that you should not be taking. It's unfortunately within the medical field, it's common that you receive medicines from one doctor. If you see another doctor, you get another set of medicines. If you're ever in the hospital, you may get another set of medications. Some of them may be similar medications, and so you may not need to be on all of these medications. And so it's very helpful to discuss about what medications you should be taking and if there are any that can be eliminated. Some may not be able to be. We do know, especially for my field within the cardiovascular world, that aspirin, if you need it, should be continued, and a cholesterol medication, if you need it, should be continued. But in other medications, there may be areas for removal of some medications. Big things going forward, again, in terms of safety and prevention. We talked a lot about this with smoking. If you do smoke, it's recommended that you quit. There are no benefits to smoking. If you're exposed to any secondhand smoke, again, helpful if you were to eliminate that or remove yourself from that situation. We know that smoking can go on to cause lung cancer. Smoking is a risk factor for cardiovascular disease with heart attack or stroke. And we talked about the enlargement in the aorta as well. So no benefits to smoking, so smoking should be eliminated. Alcohol, I did mention in the beginning with the Mediterranean diet that wine can be helpful. We usually say that everyone or anyone who is drinking alcohol should be screened for alcohol use or misuse. There are potential areas of concern where there can be dangers with driving while intoxicated or risk for accidents or some other problems that can arise with one's job or social situation. So alcohol use is something that should always be moderated, and if it can be decreased, it's probably better. There are some connections as we move forward with fall prevention. There can be some people who may be at risk for falls. We usually think of these people who may be in long-term care facilities, but it's possible in anyone as we get older. And ways to help prevent or reduce falling include things like exercising and improving your muscle strength. And so this is something that's recommended for age 65 plus and above. But as we mentioned in the beginning, daily exercise for 20 to 30 minutes is always helpful for everyone. And if we move on to an area that may not be as needed for the Nigerian population, but we can look at bone mineral density. In some postmenopausal women who are above the age of 65, they may be at risk for having osteoporosis. And so just being screened at the age of 65 in women can be helpful. Those who may be younger than the age of 65 who have risk factors, which would be previous hip fracture, smoking, alcohol use, or decreased body weight should also be screened. And then there's things that are just general safety that we can do to help reduce our risk for having any complications in life. And so seatbelt use is great with driving cars or other vehicles. I know it's not something that we typically think about when we're in Nigeria, but if at any time you're in a vehicle, wearing a seatbelt can be a way to help save your life. Within the home, having smoke detectors that work are very helpful. Another aspect within that are carbon monoxide detectors. So I recently got my parents an updated carbon monoxide detector. And so if you guys do not have that, then it's very recommended that you get that as well. And then to close out, I will talk a little bit about mental health and depression. It's not something that we do think about a lot within the African and Nigerian and even the Black community, but it's a very important topic. In the beginning of my talk, I did touch on some of these things where we can have issues with things as we transition from Nigeria to the United States, things that put a lot of stress and pressure on people in general with regards to loneliness, being away from family, the new identities. Just being able to get screened for things like depression can be very helpful. And so anyone, as you are being seen by your provider, you should hope that you can be asked certain questions to be screened for depression. The big things with regards to this are making sure that they can establish an accurate diagnosis, set up a good treatment plan, and follow up accordingly. There's various issues that can be addressed as pertaining to cultural sensitivity, self-care, and wellness, and building a good rapport with your provider. But mental health is very important and should not be something that we just put under the rug. It's something that we should pay attention to each and every day. So that is the end of my talk here for prevention. I don't know if there was any questions that you guys had.
Wow. That is an extensive. Dr. Chike Obi, thank you so much. This is an extensive presentation with so much information packed on it. I will probably allow the audience to ask questions before we leave. We try to probably compress all this information to maybe a smaller package that may be a take home. But thank you so much. I must apologize before we complete or before we start asking questions about the technical difficulties we've been having. Is basically because our technician is out and I'm trying to do what I'm trained to do. So please pardon our technical difficulties. I want the Ndi AGULU Biko, your son is here. He has poured in a lot of information. Please, I want people to ask questions and we can go from there. Thank you.
And if you want to ask questions, can you please raise your hand and you'll be called? I think I saw Liz. Is that Liz? iPhone? Yeah, you can go ahead and ask. After Liz comes Mr. Ebe.
I think you're muted.
Liz, you're muted.
Yeah. Can you hear me?
Yes.
Yes.
Okay. My question is on this hepatitis A and B vaccine recommended for people that wants to travel to Nigeria. At what particular age is it necessary for us to take this vaccine for hepatitis A and B, please?
Yeah, it is something that is recommended right at birth, pretty quickly, early on. So if there's a whole series, I think it's at least 2 to 3 shots that one gets, regardless of age. But it's recommended at least when at birth in beginning, and then if you've not received it, then you can start your series at any time. But it usually goes over a 6 months to 1 year period of the shots. And then once you've gotten it, then you usually are good and hopefully can be protected against hepatitis A and hepatitis B.
Oh, so the one we got from birth is okay. We don't have to
Yes,
take
if
it
you've
again.
received it already, then you should be okay.
Okay, thank you so much, Doc.
You're welcome.
Mr. Ebe, you're next.
Are you hearing me?
Yes.
Yeah, I live in Nigeria. I want to talk about ask question based on if people. Oh, sorry. What you said about palm oil that people consume back home. Are you inferring that it's not healthy or what?
There are some reports that say it's not as healthy as olive oil because it has a higher fat content to it. And yes, so it's some say that it's not as healthy as the other possible vegetable oils that could be used.
So how do we do it at home when they consume a lot of it? Virtually every meal they cook there is palm oil.
Yeah, if there's another oil that can be used or they can decrease the amounts. I know it's difficult when it's been used for such a long time, but we do know that it can increase cholesterol levels, which then would go on to increase other health risks that one could have.
Yeah, thank you.
You're welcome.
Before next question, I just want to tell the audience one thing, please. We muted everybody. That's what the button we were looking for before, but we finally found it. So you are baseline muted. Please, there's a microphone in front. Press on it to unmute yourself to be able to speak. But the controller, the co-host now mutes everybody, and it is only when you are told to speak, and then you can unmute yourself. I'm a next person.
Ilinofu. I think I saw your hand.
No.
Oh, okay.
It's not enough.
tobacco powder in the nose. What is the effect of that, please?
So it'd be very similar. Any tobacco products that enter the body can lead to problems that one can develop. It generally depends on the area where it's being taken. Like if you're smoking it, it goes into the lungs and will cause lung cancer. If it's somewhere else within like the mouth, the nose, it can lead to potential cancers in those areas. So that's where the problem would arise.
You said prostate exam, does it stop at 70 or thereabout?
Yes, for the prostate screening, and there is a cutoff just because we feel that with prostate cancer itself, it, like I said, does not generally lead to death. It can just lead to some symptoms that one develops. And so if it's beyond the age of 70, if you were to develop prostate cancer, then it's not likely that it'd be something that would end your life. It would be something that you would live with.
Okay. Any more questions from anybody? Please raise your hand.
Just kidding. Thank you. Thank you.
You're welcome.
The chair.
Go ahead.
Okay. Dr. Chike Obi, thank you so much. What a delightful moment. You made mention of palm oil. Unfortunately, just 2 weeks ago, my wife bought a 25-gallon of palm oil. I don't
Start sharing it.
I don't know what we're going to do about it. However, it's good to have such information. My question is on sickle cell anemia. You made mention of getting a kind of vaccine. I didn't know there was, I don't know if you mentioned a vaccine against sickle cell anemia. I didn't catch you, on that. Could you please?
Yes. So, not necessarily a vaccine that prevents sickle cell anemia, but within sickle cell anemia, there can be problems with the spleen, and the spleen does a very good job of cleaning the blood, and there are certain bacterial infections that one can get that the spleen would clean, but if the spleen is not functioning as well as it should, then you would be at increased risk for having this infection in the body and in the blood cause a serious problem. And so there are certain vaccinations that can be helpful for someone who has sickle cell anemia or who has a spleen that does not work. One of them is called Haemophilus, and the other one would be something like a meningococcal. But there's others, like a pneumococcal as well.
Thank you so much.
Are any of the trials, sickle cell trials, and any of them coming to be available open use?
That is something I'm not entirely familiar with. I've seen reports on certain types of gene editing potentially that can be helpful. But beyond that, I could not speak that much more on it.
Do we have any more questions?
Okay, thank you, Dr. Chike.
Okay, who is this? Your name, please? Uh-oh.
Ready.
Go ahead, Dr. Nene.
Yes, I want to kind of compress this information that Dr. Chike Obi has been so helpful to present into a smaller, just about 10 or 13. He's not going to cover everything, but at least something you're going to remember will help you to understand everything he's saying today, because there's so much information. So here we go. Give me a little time.
Nico, can I ask a question?
You can.
Who is it?
Dozie, Obi Dozie. Dr. Chike Obi, you made mention of the need for us to get this COVID-19 vaccine.
Mm-hmm.
We've gotten the first dose, gotten the second dose. We got the booster dose. There is a fourth generation dose coming on. We don't know when these doses will end. Is it advisable to keep getting all these doses and booster doses of COVID-19 vaccine?
Yeah, it's a very good question. I would say that it is advisable. They have done continued studies on this. The folks at Pfizer and Moderna, they've been looking at this and doing the studies. We know that COVID-19, or just COVID in general, it does mutate, and some of those mutations can affect the previous efficacy of the initial vaccination. And getting that boost allows for the immune cells that your body is generating to revamp themselves, get more circulation within your body to help prevent against these strains that are coming out, or prevent against these times when there's increased infection that's present within the community. And so as the COVID-19 comes and goes, the amount of immune cells in your body starts to wane, and getting that booster dose, similar to like the flu vaccine that you get every year, kind of picks up your immune cells again to help it fight against COVID-19. We've seen that although it may not prevent you from getting the actual infection, it definitely can reduce your chances of having a severe response to it and keep you out of the hospital.
Thank you.
Thank you.
You're welcome.
Obikili, you have the floor now.
Yeah. Doc, I want to ask a question on blood pressure, high BP. Recently, my brother told me about, he call it miracle bracelet. I don't know if you heard of it, and whether it can prevent BP rather than everyday pills. Can that work in a medical field?
Yeah, what was the name of it?
Scientific Revolution or something like that. It's manufactured by a company. Do we have something like that can prevent BP rather than pills?
Not that I'm aware of. The things that we know that can be helpful to help reduce blood pressure can be things like exercise, things like weight loss, improvements in your diet. There can be certain medical conditions that one has that, if they are properly treated, can also help improve one's blood pressure. Some things along those lines could be things like thyroid disease, sleep apnea. There's things like Cushing's disease, just various things that potentially could be treated that could then help with one's blood pressure. But I don't know if there's any specific miracle pill that would take away from needing to be on blood pressure medicine if your blood pressure is elevated.
It's not a pill, it's a bracelet, something like a bangle.
Oh.
No, I've not heard of that, so no, I don't know.
Okay.
Yeah, please, one more question from the chair. You made mention of taking aspirin, and there was something recently before my mom passed. She was, I was constantly in communication with her, but she told me, I think 2-3 months before she passed, that her primary doctor advised her against the use of aspirin that is actually meant for white people mostly. And, it was like a big shock to me. And I was, you know, but now you mention about the use of aspirin. Is there any risk in taking aspirin as regards to we that from African, descent?
I have not read anything about the risk of taking aspirin for those of African descent. Aspirin works by making some component within the blood called platelets. They clump together to prevent clots, or to make clots happen, is what platelets do. So if you cut yourself, your platelets will clump together to clot off the blood and prevent you from bleeding. The reason we give aspirin is to make the platelets more slippery, and so that they are not clumping together within the blood vessels of the heart or clumping together within the blood vessels of the brain. And so nothing I've seen that says that aspirin in Black patients or aspirin in patients of African descent does not work. We commonly give aspirin for patients, and we can see good effects for it. With regards to when we say who should be on it and who should not be on it, from a cardiologist's perspective, we say if you have blockage in your arteries, whether that's in the heart arteries, leg arteries, neck arteries, brain arteries, you should be on an aspirin and take it every day. And if you don't have that, then it's less likely that you should need the aspirin. I did talk about a specific scenario where if you're age 50 to 60 and you have increased risk factors, but don't actually have any known blockage in your arteries, then aspirin use can be helpful if you're not going to have any bleeding problems. But for the most part, it's just for those who have known blockage in their arteries, in terms of helping to make the platelets more slippery so they don't cause blockages more so than what you have.
Thank you, Dr. Obi.
You're welcome.
Thank you, Dr. B. Dr. Obi, before I join them is interview. So thank you so much. I'm gonna try to share a little screen to compress everything, not everything, kind of a little summary of what you could take home from what he has said today. He will probably use that as well to, if there's anybody asking questions, and we could go from there as well. Is everybody able to see my screen? Is everybody able to see the screen, please?
Yes,
Yeah.
sir.
Yes.
Yes.
Okay, so the topic he spoke on today is the health maintenance. Required health maintenance, as we decided during the executive meeting. So the reason for this topic is because we know that most of us here neglect our health because of certain cultural belief that you only go to a doctor when you're sick. If I'm not sick, why am I going there to waste money? So this is more of, we look at human being as a brand new car that, if maintained properly, given the oil, the alignment, and so on, will last long with a quality. So that's what we look at as the primary care setting with regard to health maintenance. And that's the major primary thing. Now, under this, so from birth to death, if you look at human being that way, just like buying a brand new car till you throw it away, we look at human being that way in our head. Physicians do this. And we look at human being as the complex machine ever built by the most powerful God. However, it requires servicing to keep it running with maximum efficiency. Your actions and inactions can determine how long and quality of this machine before it knocks engine, which we know is going to happen just time. But we want to keep it running with good efficiency for a long time. Now, service station are your primary care or family physician offices. Some of these are the simple things we could do to keep this machine running properly without till its lifespan comes to an end. One, blood pressure servicing. I'm calling all this servicing to bring it home to the way everyday human being could appreciate it. Things you have to do is to get a digital blood pressure monitor. It costs only $25 to $35 at Walmart or CVS or Walgreens. You check once or twice a week. Goal to keep the goal we want to see, which you could keep a record now on the phone or your paper, is the top number to be between 110 to 140. You know, this is just, I will accept 140. The reality of textbook may be 120, 130. 140 is already on the high end. But hey, if that's what I could get instead of 200 and 180, I'll take that. The bottom number we're looking at should be between 60 to 80. And it's always good. Your primary care family physician will be happy. Dr. Chike Obi will be happy if we send you to him as a primary care, referring you to a specialist. If you bring these numbers and he sees your heart rate and, on this range. Now, the goal of doing this is because we know with this simple act, we could stop stroke, heart attack, or kidney failure. Because when this happens, the engine is already, one of the parts is already knocked. And we don't want to do that. We want to stop it before that becomes the issue. The second thing you could do is what he has said as well. This is compressing what he has said. Cholesterol monitoring. If you go to your primary care doctor, a lot of them will ask you, just like we do all here, have a cholesterol level checked at least once a year. Discuss diet, exercise to lower it. No AGULU on regular basis. Stop heart, this simple act also help you stop heart attack and stroke. No AGULU. Well, on regular basis is the point there. Then he talked about diabetes screening. You go to your primary care doctor, you have one. If you don't have urgent care, can do the same thing. Fasting blood sugar check. We're trying to figure out if you have diabetes. If that is important, to jump on it early before it causes all the havoc. Have the blood sugar checked. We're looking at let it be less than 126 milligrams. They will do something we call A1C as well with a target. Depending, as long as it's less than 6.4, you're not diabetic. This number, we said your borderline, counsel you about exercise, stop, change what you're eating to help you get to, stay away from diabetes. Weight screening. Everybody can buy this in Walmart. It's $5, $10. Hop on it after before washing or shower and so on, and keep a record. There's no single weight that is good. It just depends on your height. And we do the little mathematics, whether it's BMI, how high that is. And that will help counsel you. Your doctor will tell you about this. The consequences of being morbidly obese or obesity is so much. Once you're in that range, they're bound to start asking about, checking you for cholesterol and checking you for sugar, because they know these are the part of the outcome of this. Now, he talked about breast cancer screening. The importance of mammogram every year or biannually, some recommendations, insurance issue, depending on the state where you are, the payers are stingy. We do it annually here. Most of the insurance will pay for that. Cover it free. It don't cost our ladies anything because we don't know how to treat this. Once the cancer is mentioned, it's more difficult than they pick up a lump and they go and nip it up right away. So that's how's a lot. We don't want to do chemo. We want to pick anything that shouldn't be there gets taken away. If somebody has had a breast cancer or there's a family history, definitely give that information to your PCP because they want to go further to do what we call the genetic testing, see if there's a mutation in something that every member of that family is going to be at risk of. And if that, they jump on it. So it's your, to talk about this when you see primary care doctor. There's no need hiding it or whatever, keeping it in the cooler, please. This simple act will stop breast cancer. Cervical cancer screening, he talked about that as well. All female 21 to 65 every 2 years. Nothing wrong if you do it every year. Some school of thought is actually once a young girl becomes sexually active, there is importance for that to start screening them, make sure. But 21 to 65, you hear about the pap smear with your PCP. This stops that cancer that once it's there, really survival rate is very, very small. Then this takes us to colon cancer. It's important to have a stool test. There's a card your PCP will give you, has 3 cards. They call it poop tests. Put a little smear there, send it back to them, or the one that insurance will mail to you, you just put it in the toilet, sit on it, poop on it, close it, UPS will pick it up, So we do this annually. You could get a colonoscopy once you're from the age 50, or if there's a family history of cancer. Once you do one, you're good for 10 years. Unless during that they found there's a little polyps, a little growth, which is what we're looking for. Nip it off. They said, come back in 3 to 5 years, because we're not sure if we miss some. These are deadly things that turns into something so difficult to treat, or a sentence of death. We don't want that. Stop colon cancer by this simple act. Prostate cancer, he mentioned that to you as well. Men, age 55 to 69. There's a lot of debate about this. He talked about that as well. Just putting it. But if you have any symptom, if you have any concern, discuss with the PCP. I do this regularly because it's just disastrous when we see it, especially in our people as well. To look at the PSA, if it's creeping up significant, right away send you to a urologist who will help take it from there. And by this simple act, you're stopping a prostate cancer. We know it's a cancer that grows very slowly, and a lot of time in our own little world, we say that it doesn't really cause death in terms of it, and in most cases. But to me, I feel, why not just get it done? Depression screening, which talk to you guys. I know our culture, we always want to avoid this. Nobody want to hear I'm depressed or have a side history. But we're not smart enough on how to do blood work for who is depressed or CAT scan. It does not exist. It's just because we're idiots now. I believe later, smarter guys is going to be born, figure out how to develop a scanner that will look at your brain and say this person is depressed. Right now, it does not. So we rely on some standardized form to probe into your mind how you feel. We call it PHQ-9. There's other forms which your PCP give you. You fill it and ask questions about maybe 15 questions, and they score on that. And if your number is significant that you're depressed or something, then we give you what we call the happy pill. And it works. Just give it some time. So, bone mineral density screening, those who are menopausal from 65, we want to make sure they don't break the bone. When they simple fall, if the bone is not strong, get cracked, the person get depressed more. So we want to be ahead so that this doesn't happen as well, 65 and above. Questions is already addressed by him, but this is just a simple summarized form of some. He went into detail of the main conversation tonight. So if there's any additional question, if this helps you to put additional question to him, or myself, if I have the answers well, I will help answer that. Thank you, everyone.
Dr. Nini, just one area that I think you should add to that is also the area that Dr. B covered. And he summed it up as past issues. And under it, you have loneliness, culture shock or transition from one culture to the other, work relation issues, racism, infectious diseases. And I'm going to kind of give a little solution to that. And the solution will be stay with APC North America because we will visit those topics later.
That's good. And Dr. Onyekwala is also on the platform, Bielo Onyekwala. I don't know, I'm sure he might have something to put into the people, our people as well, as today is physicians trying to give back to his community. If he's here, he might have some words as well. Dr. Agajal may be here as well. If not, that's fine, but we take it from here. Do we have any question?
Any more questions?
Like I have one short question.
Go ahead.
If a doctor tells the patient that the platelet is low, what might cause it, and what are the consequences of that?
So it could be low for many different reasons. Sometimes it could be medications that one is taking, or it may just be that they are low from the birth and they just have maybe a slight abnormality. But I would say that getting it investigated with some scans and further blood tests would be the strategy.
Okay. Thank you so much, Doc.
Mm-hmm.
Yes, and it depends again on how low it is. Some people, when it's too low, they bleed. Sometimes it's just something that will monitor and, check all other medical history the person has. If he has sickle cell, like he already mentioned, with a large spleen, that be causing something called consumption, thrombocytopenia, which means that this is eating up the platelet. So it's not something that we treat singly on its own. It's kind of, you're going to look at the whole picture of who the patient is. But that's it.
Okay, thank you so much.
Biko, Dr. Onene, is there anywhere we can have those bullet points that Dr. Chike talked about, posted on the platform? That way, we can, digest them some more.
Definitely, this is being recorded, as well as he could provide the additional stuff which you could post as well. So he's one of our own. We're not, he's still around with us. So we can do that, definitely.
Great.
Can we
Let him go.
acknowledge?
So, on behalf of AGULU North America, AGULU People's Union North America, the executive, the general body, we want to thank Dr. Chike Obi for this detailed presentation tonight. we want to ask him to please feel free. That I hope we will be able to approach him in his near future to talk specifically about his specialist area, which is the heart. So he can tell us more about the heart. This one he covered quite a lot of stuff. So Dr. B, please, thank you. I want 2 or 3 people to please thank him as well on our behalf. Dr. Ndechek, could you help us as well?
Dr. Chike Obi, we will never thank you enough. We are so happy to have you today in our midst. And, we didn't know we have such a, person like you. And we want to also say that as often as possible, if you can, educate us more on this, it will help us. So on behalf of AGULU People's Union North America, once again, we thank you and we say may God bless you and your career and your family in Jesus' name.
Amen.
And thank you.
Can I chime in? Dr. Chike Obi, thank you for coming. But I'm not just thanking you for today because you're one of us. The door is open for you anytime. You know we know your schedule is busy, but we also have our kids who are like you that would want to see your face as often. Thank you for coming. We got everything you said. We will try to adjust and practice some of them. Dr. Nene, you can take it.
Yes. So, thank you very much. We're gonna now continue start the general meeting.
Thank you for having me, and I will definitely like to be back to talk more and just to continue with you guys as well as I'm definitely part of the AGULU community. Thank you.
Good.
Thank you. Thank you.
God bless you.
Thank you, Chike.
Yes, God bless.